My name is Jennifer Armstrong, and I'm the Vice President of Customer Engagement Operations for Centerstone. And this year I'll be speaking at the National Council for Behavioral Health National Conference with a panel of crisis experts around moving from risk assessment to patient-centered safety assessment. You know, one thing I really love about this conference, there are so many different disciplines represented here, all for the common goal of trying to standardize best practices around providing healthcare services. So you're talking not only mental health providers, but primary care providers, educators. So it's a really good chance to network and really start to take a look at how others address some of the issues that we're trying to address within Centerstone. One thing that I've really noticed, especially in the last probably 5 to 7 years, is a real shift to implementing ways that we can standardize the way that we screen for suicide risk in general. And not only that, but what do we do with that assessment? And so I think part of this presentation, which I'm very excited about, is you have the information, now what? How do we ensure that those people get into the services that they need, help create follow-up programs around that so that they get connected to the right resources the first time. I think for sure over the last 5 years, we have seen truly a push, especially in the state of Tennessee, to standardize several things around suicide care. One being screening, making sure that our providers are asking the same questions every time, despite at what touch point that client is within care. Another push is really looking at evidence-based care once someone's identified for suicide risk and really starting to implement that with our providers. We're not there yet. I don't think anyone has arrived, but I know that within the state of Tennessee, we're looking at standardizing those two things. The third is collaborative care within the community and looking at other touch points again, for example, upstream approach like primary care for those that will not ever probably reach out for mental health care, but we know that they're going to their primary care within 45 days of taking their life. So really looking at trying to collaborate with primary care providers and embedding those standardized screenings so they can have early identification and then creating easy access into mental health services. So I think that transitional care has been a huge push, and I definitely think in the state of Tennessee that has had some impact.